نهاركم طيب. اليوم خشينا new topic which is the series أو مجموعة الميني توكس أو المحاضرات القصيرة على transplantation. معكم دكتور المهدي الخماس. I'm Professor Emeritus. I'm really quite excited to be with you. The level of these mini talks is going to be mostly for advanced students, for the general practitioner, for the family physician, young doctors, and so on, for people who are not really deeply involved within the transplant. So I just want to make the transplantation surgery very simple and introduce it, and then later on we may get into discussion of deeper issues that are related to transplantation. So today we're going to start with a very simple topic. Is the terminology we use very common. Sometimes it's confusing for people who are not in the transplant arena day in and day out. And of course, this is the simplest of the simple. What do we mean by transplantation? We mean taking an organ from one place and putting it in a different place, so transplanting it in a different place. Of course, it's used to treat and replace the function of failing organs. So people who have kidney failure, we call them end-stage renal disease or end-stage kidney disease. Either before they start dialysis or while they are on dialysis, we can help them by giving them a kidney transplant, and that's really the treatment of choice. So dialysis is a temporary thing. It's not meant really for life, but if there is no other choice, of course dialysis is better than nothing. What are the types of transplantation? نسمع, we hear auto-transplantation. So you may read it in a book, you may read it in an article, you may read it in Google, you may hear it on YouTube or TV. Auto-transplantation means that you take the organ from the same person and transplanting it to the same individual, same person. So some kidney diseases or tumors may require removing the kidney and then working outside of the body, remove the tumor of the kidney, and the remnant of the kidney you bring it back and you transplant it to the patient in a different place. So that's called auto-transplantation. في الحالة هذه the kidney is called autograft, and الترانسبلانت أو الgraft is the one you're transplanting into the body. Allotransplantation وهذه الcommon things. هذا يعني هل نديروا فيه طول اليوم وطول السنة. يعني أنك تأخذ kidney from one individual and you transplanted it in a different individual. تأخذ a piece of a liver or the whole liver from an individual, you transplant it in a different individual. أو حد متوفي دماغيا أو ما يسمى سريريا, and you take the lung, or you take the heart, or you take the pancreas, and you transplant it into somebody else who needs it. So those called allografts, the organs, or allogenic, or allotransplantation. Isotransplantation, يعني from identical twins, is not very common, لكن معناها the same really genetic composition. So it's syngeneic transplant or syngraft. Now, the xenotransplantation, I'm not going to say it in my career, but it is really a hot topic. يعني موضوع ساخن في الأبحاث الطبية, أنك أنت لو تكتشف يوم من الأيام وتقدر تاخذ kidney from an animal and you transplant it to a human being without creating problems, without transferring infections and so on, that would be really, really cool and very, very impressive, because the main problem nowadays is that we don't have enough organs. ما فيش متبرعين كفاية اللي يسدوا حاجة الناس المحتاجين لزراعة أعضاء. أيضا العملية في حد ذاتها فيه وصف معين لما تقوله أنت على طول تفهم أن إيش صار. مثلا كلمة orthotopic transplant. أنا على طول when I hear that I understand أنه diseased organ was removed before transplanting the organ in its place. It's very common في الهارت, في اللنج, and the liver transplant. Usually when we dictate the operation in the liver transplant, we dictate two parts. We dictate part of removal of the liver, and then we dictate part of the surgery of orthotopic transplantation of the liver. A heterotopic transplant, this is where the kidney, most of the kidney transplants are done that way. We don't touch the natural kidneys of the person who had kidney failure. We bring in the new kidney and we transplant it in a different place without touching the old kidneys. So this is called heterotopic. Auxiliary transplant, I read about it, but I have never really done one, where you may, for example, you may take a small or part of a liver and transplant it into a patient who has a liver problem that is acute and you think it may get better. It's just a matter of time, viral illness, and a matter of time then the liver will improve. But it's really not used commonly, so just for the sake of completing the terminology shortly. In the future we're going to talk a little bit about the anatomy when we talk about the procedure of kidney transplant, talk about the anatomy of the kidney and the ureters, and we'll talk about briefly about some diseases, like in this kidney is the polycystic kidney, and polycystic kidney disease is one of the causes of kidney failure, and such patients, they require kidney transplantation and they do very well. We'll talk also about complications of transplantation, such as rejection and the types of rejection and what to do with them and how you diagnose them and treat them. So it's going to be a very exciting group of many lectures, and I will try to stay short and stay within the time. I appreciate it. I wish you the best. Have a great week, and we'll see you shortly. Thank you so much. I hope you can subscribe to the channel if you like the talks. If not, you're more than welcome just to listen and leave.